Welcome to Pioneer Portraits. I am your host, Darla Miller. Join me as we dig into the university experience of Malone students and alumni and hear more about what challenges, encourages, and inspires them. Today, we get to talk to nursing students, and so our focus is all about you guys and what you do for the university. And so I'm going to ask for a quick introduction, and we'll start with our esteemed faculty member. And I've already asked you this question, but tell us again your name, where you work, where you did work, Carrie, if you don't mind.
Yeah.
And then also your graduation year.
Yeah. I'm Carrie Stroup. I'm the chair of the nursing department here at Malone. I actually graduated from our bachelor's program, so I'm an alumni as well. Surprise, yes. In 99 was when I graduated from Malone, so this did used to be my lab when I was here. Prior to working in education, I was an oncology nurse at Akron General for about 14 years. Yeah.
Very cool.
I'm Cierra Gurney. I graduated from the BSN program here in May of 23, so just a couple months ago. I currently work at Akron Children's on the oncology unit, and I'm currently in the FNP program right now.
And what is the FNB program?
The family nurse practitioner.
Wonderful.
All right. I'm Dishon Kamwesa. I graduated from the BSN program in 2010, and the MSN program went through the same FNP program in 2019, and I currently work at Massillon Family Practice.
Can you guys tell me the difference in what a nurse practitioner does? That's what FNP is standing for, right? What is the F?
Family.
Oh, family, okay.
Mm-hmm.
You said that, I think. And then what's the difference in a nurse practitioner and a regular RN?
Yeah, so family nurse practitioner, you have more of a provider role as far as prescription, right? So I can prescribe medications, I can make, diagnoses for patients, I can develop a treatment plan. That's, it's kind of like a physician's assistant in the role. Whereas as a registered nurse, primarily care administration. I mean, you can speak to that a little bit.
Yeah.
Just the prescriptive role I think is a little bit different.
Okay, good. So what caused you to want to go into nursing? And then I'd also like to know, why did you pick Malone?
Okay. For me, when I was like a freshman going into high school, I broke my ankle in a softball game, and I had all these great nurses take care of me, and that kind of like pushed me towards a nursing role. I also had my pediatrician. I shadowed him, and he's like, "Oh, you should be a nurse. It's a great field, and like, then you can like take care of anyone you want." And like, I've always liked kids, and I always liked caring for people. And then I chose Malone because I wanted to go to a Christian university. I actually met with Dr. Stroup on my visit here, and she's like, "You can do it. You can do volleyball too," because I played volleyball here, and that's really what sealed the deal for me.
Wonderful.
Right. When I was graduating from high school, actually I liked it was a show called CSI, which was crime scene investigation. And I thought I wanted to be a police officer. And my mom, knowing me better, she said, "You'd probably be better suited as a nurse. You care for people, and I don't want you carrying a weapon." So I looked into it, and I prayed about it, and looked into some nursing programs, and it was between two of them. And when I came and toured Malone, like I was talking about earlier, it was just a great experience. I felt the community here, felt welcome, and the nursing program had a good track record. So it seemed to be a pretty sure bet.
Wonderful. Let's talk for a quick second about our track record, because we should sing about it every time we can.
We should.
I'm not going to sing, however.
I'm not either.
So NCLEX, passage rate 100%, congratulations. What's the norm for that with other schools?
Traditionally, the nationwide average for NCLEX has been sitting right around 85 to 88% in recent years. And so we've had several years within recent memory where we've had 100%. I think our 5-year average right now is 96%, I believe. So we have a very strong track record as far as our NCLEX success. We're particularly proud about this year because the NCLEX changed. So this was the first class. I don't know if you knew this. The NCLEX totally changed. So now, instead of just taking multiple choice questions like it was historically, they actually have pictures of charts, and they have to interpret what's in the charts, what they would do, what the priorities are, what they anticipate. And so it's really testing them at a different level related to clinical decision making and clinical judgment. So they were the first group to take this test, and we are very, very proud of how they did and how the program was able to prepare them for something that was very much unknown as we were trying to get them ready.
Well, we're proud of you. My husband brags about this everywhere we go. And as a teacher, I've given tests. I've had to have students learn 4 tests. And quite frankly, I want a Malone grad if I'm in the hospital taking care of me, because you want your nurses to be practically perfect in every way. And we know nurses give care. You guys are the caregivers, especially in hospitals. You're the ones that are with the patients all the time. Having said that, you're working in a tough area, I would think, at Children's Hospital. How do you think Malone prepared you emotionally and spiritually for that?
All my professors obviously did a good job. Between every class period, we always had faith integration, which I think makes a difference, especially like on our unit right now. Like we've had a couple difficult weeks, and like without that integration of how to deal with like patients dying and like deal with their family members, as well as integrate our faith into that, I think it'd be really difficult each day. But they definitely prepared us in that, and I'm thankful for that.
I will tell you that 2 years ago, I think I was at the Honors Symposium, and one of the groups was doing an end-of-life study and how you guys had prepared them and why it was so important. And I think especially when we think about COVID,
Right.
how many people were, the very last person that was with them was their nurse holding their hand or being there. And I think that speaks a lot to this program.
I think it does, and I think that's something that when you talk to employers in the region, whether it's employers of our FNP students or employers of our BSN students, they prefer Malone graduates, and that's what they tell us is there's a different quality that they get in our students, and I really do think that it has to do with that holistic patient care that we teach and the faith integration that we do. One of the things that I was most proud about is, I think it was about 2 years ago, we had a nursing faculty retreat, and I posed 2 questions to the faculty. Why do you do what you do? And why do you do what you do here? And it was interesting how all of us had very similar themes as far as God putting us here to demonstrate Christ to our students so that they can demonstrate Christ to their patients and their colleagues. And so you see that across the instruction that happens and just the heart of the faculty members, I think, in the way that they interact with the students and the way that we train the students. I think it's a unique thing that we bring.
So I've heard rumors that nursing is the most difficult or one of our most difficult programs. How would you guys, first of all, 2 questions. How would you say that, besides, I know you're just extremely bright people, but how did you both prepare for that, get through really tough times academically, and is there a faculty member that you'd like to give a shout out to for helping you with that?
Yes, it was definitely one of the more difficult. I mean, it was definitely a difficult experience, academically challenging, but also I would say the community that I felt within the nursing program and the support that I felt from the staff made it so that it wasn't impossible. Lots of encouragement throughout, lots of check-ins with the staff. I had a great advisor, Stephanie Reagan. She knew my quirks. She knew my maybe some of my weaknesses, and she would call me into her office and say, "Hey, you can do this. You can do better." And she knew how to interact with me in such a way that it wasn't, I felt like I was supported. And then Julie Hooley, when she was at the Center for CST, Center for Study and Testing, I felt like I could go in there anytime, and we would sit down. We'd have a little group where we'd study together for tests, and she always was encouraging and trying to give us the resources we needed to get through this next seemingly impossible test. And I think that was, those are the two people I'd probably call out best.
Yeah.
Okay, I'm going to tell you move really close to the mic and speak up because I don't know what's happening outside, but something.
I would have to agree with that. Like, all the faculty were always so nice and welcoming. Like, there was never, like, a moment, especially, like, because I had volleyball and there'd be oftentimes I'd miss and stuff. There was never a moment where I felt like I was struggling or they weren't there to, like, help me. I'd give a shout out to Dr. Stroup because she was my advisor, and I worked closely with her for a couple semesters when I worked on my thesis. And, like, I was just always good. She always gave me guidance. She's always like, you can do this, or, like, this is how we're going to make this work. And then especially, like, moving right into the master's program, I had many talks with her about that. I'd also like to shout out Liz Weingart. She's our secretary. But she'd always, like, anytime you walk into that nurse's office, she always greet you with, like, a smile. And sometimes that's just what you needed, You take a test. Sometimes you're, like, mentally drained, and she'd always smile at you and say hi. But and I think it's just the community with nursing students. Like, you're all in it together. And I think that's especially at Malone. Like, my class had 20 people in it by the time we graduated, and we all knew each other well. And in fact, right now I work with 3 of my classmates, and it's one of the best decisions ever.
That's wonderful. It's just a great endorsement. I will tell you, one of the things that we hear the most is community at Malone. And I think the beauty of our size university and our Christian mission, honestly, is that we care enough to know your quirks. Mm-hmm. Our professors really do know their students. Mm-hmm. So that experience with your professors where they've taken the time to know who you are, and it's got to be different in nursing because I'm sure that there's some emotional separation that you have to keep. But how do you think that shaped you in caring for your patients?
I definitely think, like, the faculty at Malone helped shape us how we care for our patients, how they cared for us as students. And, like, they took time to have personal relationships with us, which is what I see as I reflect in my patient care with them and their families. And I think that's a testimony to, like, the Malone faculty, like, that they take the time to know you. And it helped you and be like, this is what I want to give to my patients, because that's what I received when I was struggling as a student.
Mm-hmm. Mm-hmm.
So, Cece, you're young.
Yeah.
And you're working in what I can only imagine is a really, really hard situation. Mm-hmm. How does your faith speak to that?
Didn't originally, like, I've never wanted to be like, oh, I've always wanted to go into this. I just kind of, when I looked for jobs, I knew I wanted to work in peds, and I had an interview here, and I knew it would be difficult, but I just remember praying and be like, God, if this is where you want me to go, then, like, I'll do it. And it's definitely difficult. There's been multiple times I've called my parents and cried just because, like, it's hard to deal with, and, like, there's nothing really, like, I can do more. Like, it's just a situation. But I definitely think faith helps. I pray all the time about it because it's hard. And, like, I couldn't imagine what it would be like without faith and having God there for me, because it's just so sad all the time. But it definitely carries me through, because in a difficult time, you can be a bright light to people when they need it the most.
Mm-hmm. Dishon, can you tell me can you think of a specific time that you had a challenge as a nursing student and how you overcame it?
A lot.
Just pick one.
Yeah.
If you can.
A specific incident. So my freshman year, I did fairly well towards the end, but that first semester, a challenge coming from, just a high school grad and really experiencing that nursing. We were doing human anatomy. I'm trying to remember.
Anatomy and physiology.
AMP with, I can't remember his name, but he was a really tough professor, really good, very, very personable, relatable. He retired, I think, a year later, but he was very tough, and I remember struggling through that quite a bit. And I had probably, I want to say maybe it's like a 2.8 GPA, where I was just, where it seemed like, oh man, if this is how it's going to start out, how's it going to end? And I remember that was one of the times when I sat down with Stephanie Reagan and kind of was lamenting a little bit the transition from high school into college, and she kind of encouraged me and said, this is just the beginning. You got this. You have to get serious about this. If this is what you want to do, we need to kind of get serious about it and use the resources you have. And that was the push I needed, and I ended up really doing a lot better that second semester and got a lot more energy to keep going. And I think that was a pivotal moment to where I could have, I'm going to drop out of the program, or I don't think this is what it is for me. But really talking with her and her sharing her experience and saying, yeah, this is something we all struggle through. It's a transition. It's tough. But you have, trust in God that He's put you in the right place. Trust that you're in the right program. And if you really want to do this, you'll do fine. And she was right. But she usually was. So, yeah. So, yeah, that's one of many moments, but that was probably the most pivotal one I can recall.
How about you, Cece? You have a story that came to mind?
There's many instances. I don't have, an exact one that I can think of, but just, you're a nursing student. It's struggle. It's hard. You got exams. I know probably, the hardest time would have been, critical care because, at that moment, it's, everything thrown together, and it's hard. And I just remember Dr. Weiss always did a good job. She would always have these, review Jeopardy games for us, and I think that really helped us because before then, we had, 10, 100-slide PowerPoints, and, I'm I can't get through all this in a weekend. But we'd play those Jeopardy games, and she really helped us. And I think my favorite part, before every exam and, all of our nursing classes, we'd always take the time to pray before an exam, and you just, felt peace because up to then, you're, trying to cram everything in, and then we'd just pray, and then you felt good before you took your exam.
Great. What do you think makes a good nurse?
I'd say someone who wants to treat people as if they're family. And even more than that, because not everybody likes their family. So maybe even more than that, treating people as if everybody's created in the image of God. I think if you approach every patient that way, every situation that way, coworkers, administrators, whoever it may be, it gives you a certain perspective so that you're not so caught up in the moment, in the emotion of the moment, and the stress of the moment, because nursing is stressful. Nursing is difficult. But yeah, that's what I'd say.
Yeah. I would have to agree with that. I haven't worked as a nurse too long, but I've definitely had difficult situations with some, pretty rough patients. And, in the moment, it's very stressful. They're screaming, they're yelling at you, and you particularly didn't do anything wrong. But if you view them in the image of God, it's a lot easier to understand, this is a difficult time for them, and they deserve the same treatment as the patients over there that are so nice and sweet. And I think that's important as a nurse, to treat everyone the same.
If someone wants to be a nurse, what advice would you give them?
I would tell them that it's worth it. All the long nights studying and cramming and being stressed. The moment that you get to be with a patient when something good happens or when you take care of them. Especially on our floor, there's a lot of difficult times, but there's also the good times when you get to see the little kids ring the bell because they finished their treatment, and that moment in itself is worth it for all of it.
Yeah, I'd have to agree with that. Yeah, I would say it. Anything worth doing, you have to count the cost of, right? So I think there's probably a decent amount of people that I've experienced in the nursing field who maybe have gone into it for the wrong reasons, and then they get overwhelmed, they get stressed, they get burned out, and that can happen to anybody. But if you're not willing to count the cost and say, hey, you know what, at the end of the day, this is worth it. It's meaningful work. Then it helps you, again, to get through the difficult times and really enjoy the good times, really enjoy the memories. Yeah.
I think it's one of the unique privileges of what a nurse really is, and why they call nursing an art and a science, is you're bringing yourself, your personality, your unique giftings, the way that God's uniquely wired you, to that patient interaction, often interacting with a patient on potentially their worst day that they've been through. And you're being welcomed into, one way or another, welcomed into a conversation, into a level of intimacy with that person that they don't give to most people. And so it is this very privileged position that you get to step into, and make compassionate decisions, and also make clinical judgment and critical thinking, and applying all of your discernment to the situation as well, to think about how to respond. So it is really that balance of an art and a science that you get to see in the profession.
That's really beautiful.
Well, thank you.
Why should future students choose Malone?
I think for the reasons we've stated, I would say that this is a Christ-centered university. And being that it's a Christ-centered university, you will be prepared to face a lot of challenges, but you'll also be prepared to have a perspective on life and in your profession that will set you apart. I think I've had a few of my bosses tell me, I'm glad that we have hired Malone grads, because we know the quality of the students that we're getting. We know the quality of the professionals that we're getting. So I would say, it's a great place to prepare you for life in a lot of ways.
Yeah, I would agree with that. I think if you want to go somewhere when you're struggling with school and stuff, it's so stressful. You want somewhere where the professors take the time to know you, where you have that community with your fellow classmates, and that's what's going to get you through and what's going to prepare you for when you go into the real life. And I don't think you can find that anywhere else other than here.
I think that's a great spot to end. So thanks so much for taking time. I know you guys both have to get back to work, don't you? So there are patients waiting. And I'm really honored that you spent some time with us today. So thank you.
Thank you.
Thank you.
Thanks again for joining us today for Pioneer Portraits. I hope you will pray for Malone University. Send us students. Come visit our campus and speak well of us. If you like what you hear, share this episode on your social media or tell a friend the old-fashioned way.